guys, it's Todd the Middle-Aged Viking for an exciting episode of me and TRT. Part 1. However, it might end up being you and TRT. So in Part 1, we're going to go over some factual information. What is TRT? Why is TRT used for low testosterone? What are the causes of low testosterone? And what do the symptoms look like? And if you have identified causes and symptoms in yourself, what the next step is. In Part 2, we're going to talk about treatment, the actual TRT part. And then we're going to talk about some tips and things I've picked up along the way, because I've been on TRT myself now for about a year and a half. So TRT is the therapy that you use or that you start when basically you're diagnosed with hypogonadism, or essentially your body does not make enough testosterone. So, how do you know you have low T? Well, it's really identified by symptoms, just like everything else, right? So let's talk about the symptoms of specifically low testosterone. So my source today is the Cleveland Clinic, and as usual, I will cite my sources through this video so you can do your own research. But the reason I'm doing this is because it's a subject that's near and dear to my heart. I am a sufferer of low testosterone, and I'm also a success story of TRT. And what I can tell you is that according to a lot of medical sources that I have read, up to 40% of American men over the age of 35 have reported or could report that they suffer from some form of low testosterone. That's almost half of American men 35 or older. That's a big deal. Why? Well, it's pretty much caused by your typical American lifestyle. We're going to get into the details of that. But let's talk about symptoms. So if you're 35 or older, and some people I know are actually younger than 35, so this doesn't exclude just middle-aged guys. It may be that you're younger, and there are some very specific factors as to why that may be, but we'll get into it. So the very first symptom everyone talks about with low testosterone, low sex drive, right? I used to work at a 3-letter supplement store, possibly the nation's largest. And I sold a lot of testosterone boosters. Now, I'll be the first one to tell you, in my opinion, mind you, most of these testosterone boosters are bullshit. It is what it is. Do the research, you'll figure it out for yourself, I'm sure. But I had a lot of guys come in looking for them, right? Why? Well, I'm looking for it, so I'm going to play the part of the guy now. I'm looking for a test booster. I'd be asked why. Well, I'm just, I'm tired a lot, I don't have a lot of energy, I'm just looking for more energy. Well, first things first, that, under normal circumstances, is also bullshit. Here's why. If you're a guy of that age group, possibly younger, and you're looking for a test booster, the number one reason has been and always will be low sex drive and sexual dysfunction. Let's face it, guys, we don't really care if we're tired. If she's ready to go, we're ready to go. So the fact that you may not be ready to go, can't get ready to go, or don't even want to get ready to go, may be the reason you're walking into that store looking for the test booster. And it's the number one sign of low testosterone. Testosterone is the chief male sexual hormone. When you don't have enough of it, you don't really want to have sex. Or you may still want to have sex, but your body's like, nah, I'm good. And that makes you feel like less of a man. For the most part, it did me. That's the number one symptom and concern is sex drive. For damn good reason. I don't really need to go into it anymore. Decreased sense of well-being. Well, you're feeling low T, you're a little mopey, you're depressed, maybe you don't feel like much of a man because, you're not making the wife happy because you can't. You can't concentrate, your memory's gone. Well, I'm just depressed and I can't really devote any attention. I don't really have any drive. I don't have much focus. Well, those are normally secondary to your concern list to the sexual aspect, but that does come along with low T. You're fatigued. I slept all night last night. and I'm still exhausted. My muscles hurt like hell. I'm sore. God, it takes me, I did something at the gym or I did something at home and it takes so long for my muscles to stop hurting after. Well, you might have low T, which comes with loss of muscular strength and loss of muscle mass. That's a big deal. Testosterone is really, primarily responsible for having high levels of protein synthesis or muscle building. So if you have low T, you normally have low muscle. When you have high T, you have high muscle. That's generally how it goes. Some other less common things about low T. You can have a decrease in hemoglobin or become anemic. Decrease in body hair. Not necessarily hair on the top of your head, but body hair, beard, back, so on and so forth. A big one that was a concern for me was thinning of the bones or osteoporosis. When you have low testosterone, you can lose bone density. That's a big deal. So if you're a 50-year-old guy thinking, I should be fine, and you take a nasty fall, all of a sudden you broke your hip, well, that's not very good. So definitely want to avoid that. Increased body fat, that goes without saying. Breast development, gynecomastia. Wait a minute. Isn't that what steroid users get when they don't do things right? Yes, that can happen. But you can also get it when you have low T. Why? Because gynecomastia, or bitch tits, that's what they're commonly known as in the gym, happen as a result of high estrogen and low testosterone. So when your body gets out of whack, well, maybe that's why you're a 40-year-old guy that isn't all that fat, but you have these man boobs that look a lot like, they look a lot like tits. May actually be gynecomastia. You may be able to reverse it, you may not. That's a whole nother subject and a whole nother video, but it can happen. It can also cause some infertility. If you're a 35, 40-year-old guy, maybe you're trying to have a kid for the first time. You're not that interested in sex, but the wife really wants a baby. You keep trying, she's never pregnant. You may have low T, right? So how does this even happen, right? Here are the number one causes of low testosterone. And if you watched my first video, I talked about parts of my life that were before I started trying to get fit. And it's funny how many of these potential causes are in that first video. So here we go. One of the most common causes for low T is trauma to the testicle. Let's just say you took a huge shot to the nuts. They got swollen, they got black and blue, took you a while to recover. That in itself can give you issues with its testosterone. And it only takes one good shot. So protect the nuts, man. Hey, if you're young guys and you guys are playing games like bag tag or, Bangkok, whatever you want to call it, don't do it. It's not worth it. Yeah, it's funny to hit somebody in the nuts. But you take too many shots to the nuts, you could end up a 40-year-old guy with no testosterone. That's just a fact. Obesity. Well, we've talked a lot about that at length. Alcohol abuse. Well, I don't want to dump everything out on the carpet, but I will be sober for 3 years in August. So I am a recovering alcoholic on top of everything else. So that was also a contributing factor to my low T. Sleep apnea. Had that too. Diabetes. Oh, I was close. Chemotherapy can cause low T. Previous anabolic steroid use. Well, I get to check that box too. Hypothyroidism. Okay? So here's one that a lot of people don't know. Opiate use. Right? So if you're using opiate-based painkillers or you had an issue with drug addiction, that can lead to low testosterone going further down the line in your life. Also, there's been some low testosterone directly related to the use of the steroid prednisone, which is an anti-inflammatory. So you might, hurt yourself. They might put you on some steroid taper to help reduce inflammation, so on and so forth. That actually has a link to low T. So I challenge you at this point to ask yourself, have you ever had high testicle trauma? Are you obese? Do you drink like a fish? Do you snore really bad in your sleep? Do you have diabetes or are you pre-diabetic? Unfortunately, have you unfortunately gone through chemotherapy? Have you previously used anabolic steroids? That would be question one. Question two, do you know what PCT means? Because if you don't, you're in trouble. PCT stands for post-cycle therapy. It's how you turn your nuts back on and get your own testosterone to come up. So if you don't know what that is, you're probably in trouble. Hypothyroidism, that would be something that you were diagnosed with by your doctor. Have you used opioids? Are you a former addict? Have you used prednisone several times? So if any of those factors in your life are accurate, go back to the symptom list. Okay, yup, and yup. Okay, all those potential causes have been in my life. Well, I do feel like crap. No, I don't really feel like having sex. I am kind of weepy. I'm a bit moody, and I can't ever seem to get enough sleep. And I go to the gym, or I don't go to the gym, and I can't put on muscle mass, XYZ. You may have low T. So, do you have to accept it? Hell no, you don't. There are several things you can do. One, the most important thing, go to your doctor and be honest. There's some stigma here. It's embarrassing. I know people in my life that most likely, if I had to guess, have low T. But because of the symptoms, mainly the sexual side effects, it's a very embarrassing thing to talk about, especially with other people, and especially maybe friends and family. I've been there. I know what feeling less of a man feels like. It sucks. You look yourself in the mirror and you're like, what the hell? You just feel like shit. Have a conversation with your doctor. It's confidential. Watch this video. Think about it. Nobody's going to know that you watched this video. If you're watching this video and you know somebody who fits that criteria, have them watch it. If you don't want to be embarrassed, there are ways to do it without being embarrassed. Go to your doctor. Your doctor, you'd be amazed what your doctor hears. This isn't going to be a big deal. If you can't bring yourself to go see your doctor that you go to for the flu, there are doctors out there that do something called telemedicine. You can get a hold of them. They will get your information. They will send you to a lab. They will do conferences via the phone, via Skype, via FaceTime. There are legal ways for a doctor to prescribe or diagnose you and treat you from a distance. You have to be careful who you pick because some of them are less than reputable, but there are several out there that are 100% reputable. That's how I got started on TRT. So TRT, last thing I want to say is testosterone therapy. It's testosterone use, not abuse. This isn't a way to go get steroids and abuse your testosterone and take yourself to what they call a super physiological level, which means you have more testosterone than any person on the planet would normally have. This is testosterone use. And we use the testosterone, I use the testosterone so I can alleviate my symptoms, so I feel good about myself, so I can gain muscle, so I can lose weight, so I can have a good sex life, okay? These are the things that I use it for. And if you are having a problem with anything I've talked about, or any of the potential causes or parts of your life, and or any of the symptoms I've talked about are a reality for you, talk to your doctor. I am not an expert. I'm not going to claim to treat, diagnose, or cure any disease. I'm giving you information that has benefited my life. If any of this I've talked about sounds familiar, please, for the love of God, last time, go to your doctor or contact someone that does telemedicine, a reputable doctor. Get yourself tested. If you have low T and are diagnosed, there is medicine, testosterone, available to you. I guarantee you, if you use it, right? I'm not going to guarantee you. I'm going to tell you this. If you have low T and you use testosterone, there's a pretty damn good chance all those symptoms you have are going to start to go away. And how crappy you feel, how powerful that crappiness is, will be the same level of power of how good you feel. I feel like a different goddamn person since I've been on TRT. I can't say enough about it. Yes, there are risks. Yes, there are downsides, and we're going to talk about that in the next video. So, you may have noticed that we have a new intro. I'm looking at my computer using reference. I got a new laptop. I've got a lot of new gear. So hopefully you have noticed that the quality of the video, as far as resolution, has come up. The intro's a little bit new. We're making some investments here at Middle Aged Viking. I'm building a studio and an office to kind of bring up the professionalism of these videos. So stay tuned. They will get better. But in the meantime, if you liked this video, if you found it useful, please give it a like. Please subscribe to my channel. If you know anybody who has a life that is similar to what I've described, just shoot them a link. Let them watch the video. You know, it is what it is. If you got the issue, it can be corrected. God forbid anyone lets it go because some of the side effects are just horrible. Who the hell wants to live like that? So again, if you like the video, please give a like, please give a share, please subscribe. As always, I'm open to comments, both negative and positive. So again, Middle-Aged Viking signing out until next time. Take care.